I'm coming in, I'm washing my hands. I'm introducing myself to my client, Ashley. I'm Paul, I'm gonna be doing your assessment today. And I make comments to alleviate possible anxiety, like how, did you have a pleasant trip to the clinic this morning?
I did, thank you.
Okay, and then I tell her, I explain to her as I go what I'm doing. I'm gonna be checking your skin, and I go all the way around, and I check, and I look at her arms. Is it all good? You note, in your nurse's note, if there's any unusual looking nebby or wrinkles or any sort of disturbance on the skin surface. You look for bruising, scars, color, texture, moisture, temperature, what else is there? Edema. You look dead on at your client's head for confirmation. Everything is equal. The eyes are, the nose is straight. Yes, thank you. The ears are appropriately positioned to the level of the eye. I will palpate her scalp and look at her hair, color, texture. I look for any sorts of lesions. I ask her about, do you have any tenderness in your scalp?
I do not.
Okay, I look for like depressions, any kind of abnormality in development or confirmation. I will palpate her. I will palpate her lymph nodes. I will do preauricular, postauricular.
Okay.
Actually, I'm going to palpate your lymph nodes, preauricular, postauricular, occipital. Tonsillar, submandibular, submental, your anterior cervical, postcervical, supraclavicular. Okay. I feel nothing out of the ordinary. I'm going to follow this with your a CNS check. I want to see you pinch your teeth. I want to see you smile big. Okay, good deal. I want to feel your, for TMJ, put your joint right here. Okay, good deal. All right. I have a small piece of cotton right here in both hands, and I'm going to be checking your sense of touch. Can you feel this? Close your eyes.
Mm-hmm.
Okay, can you feel this?
Mm-hmm.
Okay, how about this?
Mm-hmm.
Okay, this?
Mm-hmm.
Okay, good deal. All right, now look at me. I want you to frown. Raise your eyebrows. Okay, good deal. Do your lips out. Buckle like a big kiss. Good deal. Everything is good. I'm going to check your ears. And perfect. I'm going to take a quick peek right here inside your ear canal. Good deal. Okay. Okay. If I had a light bracket, actually like look in and see your tympanic membranes. I would, note that, in your right ear, that, I would see, a, little lighter spot at 5 o'clock. 7 o'clock in your left ear, you have normal ear canals. I will do, a test for, cranial nerve 8, or CNS nerve 8, and I push it behind you, and I'm, repeat after me,
United States of America. United States of America.
good deal, and you have normal hearing. Next I'm gonna, do a test with a tuning fork, and I hit it, and it's humming. Can you feel this?
Yes.
You feel it evenly on both sides?
Yes.
Okay, that's the Weber test. Okay, I'm going to, do the same thing. I'm gonna do it behind your ear, to see, if you have bone conduction hearing. And I hit it, and it's humming, and I touch you right here. Can you hear that feeling?
Yes.
Okay, now I have it out in the air. Can you tell me when it stops? Can you hear it normally?
It's locked.
Good deal. Okay. And I do it again. We'll go with the same motion on the other ear. Okay. What I'm going to do now, I'm going to check your eyes. Okay. You take your glasses off, please. Okay, I want to look at your sclera. Eyes are tight. Everything's nice. Everything's equal. Eyelashes, eyebrows, everything's normal. There's no, abnormal color or discharge from your eyes. And, now I'm going to do, put your glasses back on, please. I am going to do a, check, for, CNS number 8, Snelling chart. Okay, read the.
1, 2, 3, 5, 7, E.
Okay, close one side. Okay, try this one.
1, 3, 2, 4, 5, 7, E.
Okay, try this.
1, 2, 3, 4, 5, 7, E.
Okay, all right. Now, I am going to, check your, CNS 6, 3, 4, and 6. Okay, follow the pin. Okay. All right. Focus on the pin. Stay with me. Just lift it up. Okay. I'm going to, check your, red reflex with this scope right here. I'm looking in. You have a normal red reflex. Okay. I am going to check your eyes from the side. Look straight ahead of me. Okay, I bring it right here. Just I'm checking to see how your pupils dilate and whether they accommodate right and left. Okay, everything's normal. You're looking well. You can put your glasses back on. I've already checked for T and J a while ago. We'll go through the motions again. Okay, big bites. Yeah, there you go. All right. Now I'm gonna check your sinuses. Take your glasses off, please, so I can look at it. Do you feel any kind of pain?
No.
Okay, all right. I'm gonna check your nose. It's nice and straight. Have you ever had any damage to your nose?
No.
Okay, any sort of problems with nosebleeds?
No.
Okay, I'm gonna take a peek inside your nose.
I have a deviated septum. I can't breathe.
Yes, you do. Okay, good deal. Everything is nice and straight. Now I wanna check the inside of your mouth, open wide. Okay, stick out your tongue. Okay, do you have any places that inside your mouth that, are sensitive?
No.
Okay, anything that looks unusual?
No.
Okay, stick your tongue out. This is, we're checking CNS 9 and 10. Okay, everything looks normal. uvula, looks like it's supposed to. We're going to like, do a check on your neck. Okay, you back and forth, left and right, like this. Okay, all right, okay, down, okay, back. Okay, we're gonna look at your skin all the way around. Once again, checking for, color, texture, moisture, turgor, any problems with edema, scars, lesions, any moles that look unusual. Everything, is, looking like it's supposed to. No, variation in color. Everything looks like it's supposed to. What I'm going to do now is check your trachea.
Okay.
And, okay. You feel any discomfort at all? Okay, swallow please. Okay. Okay, good deal. I'm gonna palpate your, carotid arteries. Okay. Okay, now I'm gonna go behind you, I'm gonna check your swallow. I'm feeling your thyroid gland. Okay, everything's normal. Do you have any problems at all with your neck as far as like movement? You don't have any problems like, cricks, and, there's a good word for a stiff neck, and I have lost it. What I'm going to do now is listen to your carotid. Oh, wow.
The OL is a good thing.
Okay, yeah. Okay, you done well. Okay. What, I would like to do now is, check your resistance to motion, your shoulders. Okay, this is 11. Seeing this nerve 11. Okay, up. Okay, put them down. Okay, good deal. Shoulders shrugged. Okay, and what I'm gonna do now, I'm gonna listen to your heart. And, okay, are you good?
Mm-hmm.
Okay, I start, right to left, okay. Nurses have a little, mnemonic. They do, all people eat too much, which tells where we're listening to your heart. And I'm listening to your aortic valve right here, the pulmonic valve. And right here, this is Erb's point. This is where you hear, both of these equally in the middle. Okay. Okay. Everything is normal. Mitral. Okay. Okay, right here. This is, your apical pulse. This is your point of, maximum impulse right here. 1 minute. Okay, rate, rhythm, everything sounds normal. Okay, I am going to, everything sounds normal. I'm gonna ask you to, lie down on, a bed.
Okay.
1 moment, please. Okay, with my patient supine, what I am going to do, I am going to visually look to see if anything is not symmetric, if there are any heaves or lifts while she's breathing. Now look at everything's symmetric, everything looks as it's supposed to. What I'm going to do right now is listen to the same places that I listened to before. And I'll go through the same motions. The additional thing I'll do right now, I will listen to the abdominal aorta for, you know, any, breeze, how you say it, breeze?
Breweries?
Breeze, okay. I will, assess for jugular vein distension, and there is none. Okay, and what I will do is, I can, if I have some reason to, listen, I will go all the way over here with my patient up, listening here, for, and while I'm here, what I am going to do, I am going to evaluate my patient's capillary refill, which is instantaneous. Yeah, good deal. All right, what I'm going to, do right now is get my patients to sit up safely. Okay. And what I am going to do is listen for, I am going to inspect her skin on her posterior chest and make sure that everything looks like it's supposed to. No nevy, no scars, moles. Assess for turgor, color, moisture, anything that's out of the ordinary. Any abnormalities of symmetry, you can like clearly see scapula. You can look at the lateral, how lateral the spine is, where there's deviations here. You can stand here and see the effects of the dorsals, or not of any consequence. You do not suffer from scoliosis, and I'm looking at a naked back during my what I'm going to do right now is, what I'm going to do is that I'm going to get my patient to breathe deeply. I'm going to check to see if her inhalation, the expansion of her check is symmetrical, which it is. Okay, I can look at her visually from here and get her, same thing, I can get her to go up, everything goes up left to right, as it should. What I will do now is get her to say the words 99.
99.
We're doing tactile premises to
99. 99. 99.
okay, good deal. All right. Okay. Yes. What I'm going to do now is percuss her lung fills. You would be doing this side to side, top to bottom, and what you'd be listening for is dullness, which you will always normally hear. What you're going to do is I'm going to also take her back, all of the lung fills. Same thing, I'm going to go left to right. She's going to be breathing deeply. Going to be breathing deeply, breathing deeply, breathing deeply, and I go back and forth and do the same thing. Right, you have 3. Left, you have 2. You go all the way to the bottom. Breathe in. Okay, you're clear? Mostly. Okay. Do we will check, agathony, where she says the letter E,
E,
and you'll be going, left to right, up and down,
E,
and it sounds a nice clear E, like it's supposed to. Bronchophony, we'll do 99s,
99, 99,
99s,
99, 99.
okay. It's muffled like it's supposed to be. What we would do is the, 1, 2, 3, where we do, pectoriloquy, where she does this, softly, whisper it to me.
1, 2, 3, 1, 2, 3, 1, 2, 3.
Okay, and same thing, I'll be going up and down. What I would be doing with my patient at this juncture, all of the sounds, what you don't want to hear is like a super clear enunciation, because it will denote some sort of internal consolidation that you don't want to hear. Once again, we'll be going through the motions of checking her skin, color, moisture, turgor, scars, lesions, edema. You do the thing right here where you hold the skin up to the sternum, especially with aged patients like me, to and you watch and see how the skin rebounds. Okay. We'll be doing the same thing with the tactile primitives. When you hear 99s.
99, 99, 99.
Okay, what I will do now is anteriorly listen to all of your lung fills. Deep breaths, please. Okay. All right, broncho-vesicular. Anyway, you go left to right, all the way down to the sides, and make sure that you, do it like here on both sides, so you can actually get a good feel for how, if there's anything amiss inside the lung. Okay. Now, we're going to lay you back down. Are you comfortable, patient?
I am a patient.
Okay, and what we're going to do now, we're going to inspect our patient's abdomen, and ordinarily, she would be, okay, what I'll be doing is looking for abnormalities in the normal curvature and the conformation of the body. If there were masses underneath the skin, they would be visible here. Skin, you'll be doing the ordinary, the same thing we've always done, color, moisture, texture, edema, all those things. Now we'll be listening to aorta, okay, renal arteries, iliac, femoral. We'll be oscitating for bowel sound, all 4 quadrants. Okay, you do, right to left, you go all the way around, you check for, you will be percussing all 4 quadrants. Everything's normal, it looks like it's supposed to be. Once you percuss and all the sounds are normal, you'll be palpating. You'll be looking for masses, for things that are out of the ordinary. You will be